Hello, my name is Tiffany Drain. My pronouns are she, her, and I am the Regional Council Manager for Birth to 5 Illinois, Region 1BB, covering West Cook County. Thank you for watching Region 1BB's Early Childhood Regional Needs Assessment virtual report. This recorded session will provide an overview of findings from the Birth to 5 Illinois Region 1BB Needs Assessment, as well as talk about the strengths, needs, and recommendations for improving access to and enrollment in early childhood education and care programs in the region. A link to the full report can be found in the description below. If you would like to turn on closed captioning, click the CC icon at the bottom of the video. This will turn on the captions. If you want a language different than English, click on the gear icon for settings, click on subtitles, then auto translate, and you can scroll down to pick the language you want. 2021, the Illinois Commission on Equitable Early Childhood Education and Care Funding issued a report with findings that highlighted the inequities in early childhood funding in Illinois and the need to create a better statewide infrastructure to support early childhood professionals, expand services and programs for families and caregivers, and increase enrollment in ECEC programs. The report focused on the importance of addressing racial inequities and the need to include local voices in the conversation funders and decision makers were having about early childhood education and care. To provide a structure for communities, families, and caregivers to engage with the data and share their experiences, a new statewide infrastructure was created across 39 regions, all of which align with existing Illinois State Board of Education regional offices of education boundaries, but operate independently. Birth to 5 Illinois regional boundaries align with the school districts instead of strictly following county lines, which can be a challenge for gathering and interpreting data, because many early childhood services are provided by or tied to school districts. Region 1BB is located in the northeastern part of the state, bordering Indiana and Wisconsin, and includes West Cook County. It is the traditional home and has continued connection to Peoria, Kiikapoi, Kaskaskia, Bodwimami, Potawatomi, Maimea, Ochiti, Sakowin, Pocock, Ho-Chunk, Oikikiwa, Hina Ki, Sauk, Meskawahi, Asaina Fox tribes. Popular for its vitality, diversity, and accessibility to Chicago, the West Cook region is a popular destination for those who enjoy green spaces, architectural diversity, and cultural attractions. Joining me in the Region 1BB office is Lucero Robles, our Family and Community Engagement Specialist, and our Administrative Support, Victoria Pearson. The experiences and knowledge families, caregivers, and early childhood professionals gain while navigating the complexities of the state's early childhood education and care system are valuable, and understanding their lived experience in the local context is vital for decision makers to ensure communities have access to the programs, services, and supports they need. To this end, Birth to 5 Illinois was created to harness family and caregiver voices in early childhood education and care, and serve as a bridge between the communities and policymakers so family, caregiver, and professional experiences can guide the decisions made to expand or enhance services across the state. Our mission is to create a statewide infrastructure that will amplify input from communities in the development of policies and funding priorities. We support the mobilization of communities to build and sustain equitable access to inclusive, high-quality early childhood services for all children and families in the state of Illinois. We envision that our work will help all stakeholders reimagine a more equitable early childhood education and care system that respects family and community voice and works to ensure it is centered and prioritized at every level of decision making in Illinois. We have three main values and goals. First, we must prioritize family voice. Through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. Second, we must address the racial inequities that exist in our early childhood system. In an effort to move our early childhood education and care system to one where racism no longer impacts a child's success, we will work to dismantle barriers that have limited access to high quality services for minoritized children in every corner of our state. Third, we will use the collective impact model to shift the current early childhood system to influence policy and funding at the local, regional, and state level. Birth to Five Illinois will use community driven feedback to build a system that harnesses knowledge directly from families and providers and encourages decision makers to ensure new and or expanded services are created to meet community needs.
Thank you, Tiffany, for a great introduction. I am Lucero Robles. My pronouns are she, her, and I am the Family and Community Engagement Specialist with Region 1BB. Following our values and goals, we have two critical parts of the new statewide infrastructure, which are family councils and action councils. Located in each of the 39 regions, the councils provide feedback on quantitative data from the Illinois Early Childhood Asset Map, or also known as ICAM, and the Illinois Network of Child Care Resource and Referral Agencies, also known as INCRA, to help contextualize the data at the local level. The councils meet twice a month in a virtual, in-person, or hybrid meetings. The family councils are comprised of parents or caregivers from a wide variety of family types, such as single parents, adoptive and foster parents, caregivers of relatives, teen parents, two-parent families, multi-generational families, and more. These families prioritize the voices of those who have not been involved in this type of work before. We want to highlight those who have been involved in our Region 1BB Family Council over the past year and thank them for sharing their experiences with the early childhood system. The Family Council members are Cindy Albor, Juana Avila, Azucena Galvez, Juxelin Núñez, and Edith Vargas. Action councils are comprised of early childhood education and care professionals, healthcare providers, faith leaders, elected officials, and other community members. Each action council reserved 2 seats for parents or caregivers to ensure family voices were included in every discussion. Action Council members were invited to bring additional aggregated data on programs and services provided by their agency or organization to complement data from ICAM and INCRA. We extend thanks and gratitude to our Region 1BB Action Council members: Rosalind Banks, Shannon Ellison, Ana Guevara, Tiffany Lewis, Canela Miniatis, Holly McCarthy, Emily Norman, Vivian Paliki, Precious Porras, Linda Rios, Diane Schonheider, Kathy Slattery, Glenda Thomas, Sarah Weston, and Jennifer Weisgarver. Beyond the council meetings, additional qualitative data was collected community-wide through focus groups and interviews, and all council members were invited to provide input on each section of their early childhood regional needs assessment. Region 1BB held 6 focus groups, 3 interviews, and received 5 survey responses. Council members developed the strengths, needs, and recommended next steps that are unique to each region. Regional teams, along with the support of their action and family council members, created a dissemination plan and are holding community meetings virtually and in person to share their report's findings. The following slides highlight some data that was discussed by council members and provide insights into the early childhood education and care landscape in our region. Joining us today to speak on this data is Vivian Peliki, Professional Learning Specialist of West 40 Intermediate Service Center and Region 1BB Action Council member.
Thank you, Lucero, for the introduction. Region 1BB is racially and ethnically diverse. Region 1BB is diverse within socioeconomic status. There are approximately 39,636 children under the age of 6. Part of the conversation with council members were around priority populations, defined by the Illinois Early Learning Council as groups that have been historically underserved by early childhood education and care programs. In Region 1BB, the priority populations include children living in families in poverty, children experiencing homelessness, children of teen parents, children with developmental delays and disabilities, children in families of newcomers, such as immigrants, refugees, asylum seekers. While data on children and families from priority populations is limited, there are a few things of note about Region 1BB. According to the 2020 census, 38% of the children ages birth to 5 lived at or below 200% of the federal poverty level, meaning that many of them were eligible for a number of state-funded early childhood programs. Those living at the highest rates of poverty are concentrated in the northwest and southeast parts of the region. Additionally, according to information provided by McKinney-Vento, in 2022, as many as 943 students enrolled in pre-K through 8th grade were experiencing homelessness and receiving services through school-based McKinney-Vento programming. Additional information about priority populations was gathered through surveys, interviews, and focus groups, and is included throughout our final Early Childhood Regional Needs Assessment report. Community collaborations are an integral part of the early childhood landscape. Local early childhood community collaborations bring together community agencies, organizations, and individuals with a shared vision or goal. They understand the importance of improving early childhood education and care for children, caregivers, and providers. Region 1BB has 2 established local early childhood collaborations: the Collaboration for Early Childhood of Oak Park and River Forest, and All Our Kids AOK Network in Cicero. AOK Network is a community-based collaboration promoting healthy pregnancies and positive growth and development of all children birth to 5 and their parents, caregivers, by assuring high-quality, well-coordinated, easily accessible system of services and supports through collaboration that lead to children in Cicero entering kindergarten developmentally and socially emotionally ready. The AOK Network is a collective impact collaboration that utilizes a systems change framework with a human-centered design to create strategies that lead to equitable change. The Collaboration for Early Childhood is a community-driven organization that cultivates the development of the whole child, birth to age 5, by engaging families, local organizations, early childhood educators, caregivers, and health providers to create equitable, nurturing, and interconnected systems of support and work on that mission in their everyday work. The collaboration for early childhood envisioned communities where every young child has the care, relationships, and resources needed to thrive and to begin school safe, healthy, and empowered to succeed. The collaboration for early childhood also continues to work in the following service areas: early learning, health and development, family engagement, and community engagement, making an impact beyond the borders and supporting communities in Region 1BB. More information on the local collaboration and the work they're doing can be found in the Regional Needs Assessment. Region 1BB is home to a variety of early childhood education and care programs and providers, all servicing children based on the licensing, funding, and staffing requirements. But access to early childhood programs and services is not equitable for all the region's families. Currently, there are about 39,636 children under the age of 6 in Region 1BB, and 15,171 early childhood education slots reported, resulting in a slot gap of 24,465 children without early childhood education services via a licensed or license-exempt program. This is 61.72% of the population of children under 6 in Region 1BB. Families and caregivers reported that they were highly reliant on family, friend, and neighbor care to provide child care for their children. Illinois' Child Care Assistance Program provides financial assistance for families with low incomes. The value of the benefit varies by income, household size, and the number of children receiving child care. Feedback from the community includes that it is not enough, as child care can still be unaffordable with CCAP, as the gap is increasing between the cost of child care and the rate of reimbursement have not. This program provides families with limited access to financial resources and access to quality, affordable child care while allowing caregivers to continue working and or completing their education. All families are required to cost share on a sliding scale based on family size and income. However, not all providers will accept CCAP due to delayed payments, and not all families want to complete the application, which is lengthy and can be difficult to complete. The availability of full-day publicly funded childcare in a region is a significant barrier for families and caregivers. There are publicly funded preschool options available in the region, such as Early Head Start, Preschool for All, and the Preschool for All expansion programs. However, not all programs are full day, nor do all provide transportation to and from the program, leaving many families who qualify for publicly funded preschool choosing not to enroll them in a publicly funded program. As one community member stated, when my son was 2 years old, I had to drive an hour across my region to the city of Chicago for him to receive therapy, along with being in an early childhood education setting. A parent also shared concerns with equity regarding the location of services in the region. She said, "There are always more resources in areas of higher income."
Thank you, Vivian. My name is Emily Norman. I am the Director of Pilgrim Community Nursery School in Oak Park, Illinois. Through community meetings, focus groups, interviews, and surveys, families in our region reiterated the urgent need for more affordable childcare and preschool options that are staffed with providers and teachers that are well paid, supported, and that want to continue working in the early childhood education field for the long term. Similar to other areas in our state, Region 1BB is experiencing a staff and teacher shortage. This is preventing programs from operating at our full capacity or expanding to meet our community needs. Staff turnover is a big contributor to the workforce shortage, and it remains a concern among the community members in Region 1BB. Another challenge is a lack of support. A provider that participated in a focus group shared, quote, "I am concerned about the mental strain on the staff and how the lack of training on how to handle behaviors from the kids is taxing them." Another provider called for more involvement from agencies to contribute to the growth and development of children and families, sharing, quote, We need training on specialized services. The surface level training that Gateways provides is not enough to meet the needs of children. Community feedback includes that ECEC workforce is underpaid and undervalued. The pay is low and is not a long-term option for many trying to support a family. This low pay, combined with the demands of the position and long hours, have left many staff burnt out and not willing to come back to the early childhood field. ECEC teachers earn significantly less than their primary school counterparts. Illinois early educators with a bachelor's degree are paid 49.2% less than their colleagues in the K-8 system. Transportation is a consistent barrier identified by parents, families, and caregivers, especially to or from part-day programming and specialized services. Due to the lack of services in the region for children with developmental delays and disabilities, many families report having to travel long distances to receive services. Another barrier for parents, caregivers, and families in Region 1BB is communication. Communication is a serious barrier for those who speak a language other than English, compounded by the low demographic of early childhood education and care workforce that speak a language other than English. Feedback from a focus group participant included, quote, "I struggle a little bit. I don't speak English at all, and in many opportunities I have not been provided with an interpreter, and I have a hard time because I don't know how to explain myself and I don't understand anything. I've struggled in these opportunities. But in others, they have provided me with an interpreter, but I have to wait, even after I've requested it." Community and council members identified several strengths of the early childhood system within our region. For the sake of time, I will only share a few. We have a high level of bilingualism and multilingualism throughout the communities in our region, with a strong diversity of racial, ethnic, and socioeconomic status. There is also evidence of cultural responsiveness and inclusion within our region. We also have a variety of childcare options in our region, including publicly funded programming, licensed and license-exempt center-based programming, and home-based programming. We've also seen an increase in Park District early childhood education care programs. We have also identified challenges and opportunities for growth in the regions as well. And again, for the sake of time, I'll only share a few. ECEC workforce, recruitment, and retention efforts. Early childhood educators in our region need wages that are equal to other teaching counterparts, along with benefits such as health insurance, retirement, paid time off, and support with mental health or behavioral management. Support services for children with developmental delays and disabilities. There's feedback that we need an expanded service delivery, including, quote, "We had to wait 6 months to see a developmental pediatrician. Having to wait that long to get a diagnosis means you have to wait for access to services. It was a really stressful process." Families and providers need more education regarding eligibility and access to Child Care Assistance Program, CCAP. Many reported that the process is confusing and lengthy, and some report that even with assistance, child care is still not affordable. Providers are relying on these timely payments from CCAP for their programs. And lastly, working families need more access to full-day state-funded programming. And with that, I am going to turn this over to Victoria Pearson. She is Birth Defy's Region 1BB Administrative Support Person. Thank you so much.
Thank you, Emily. My name is Victoria Pearson. I am the Regional Administrative Support for 1BB. Based on the community and council conversations, recommendations have been made on how early childhood education and care programs and services can be improved for families in the region. Recommendations will be presented to lawmakers, state agencies, local elected officials, and funders so they can better understand the needs of the family and the region and share the recommendations with them so they can see how to best meet those needs. These are a few of the recommendations made, but more can be found in the Regional Needs Assessment. Recommendation number 1. Every child needs the opportunity to access quality education and care services and support regardless of the intellectual ability or income level of the family. There needs to be funding for the expansion of publicly funded ECEC programs. Recommendation number 2, wage increase for ECEC workforce and/or targeted incentives. Recommendation number 3, increase service offerings and delivery for specialized services. This includes children and/or families with developmental delays or disabilities. Families need more access to early intervention services, such as occupational therapy, physical therapy, and speech/language therapy, and an increase in the number of professionals to serve 0 to 3. Recommendation number 4, increase in trauma-informed, culturally sensitive support for newcomers. This includes immigrants, migrants, seasonal, and/or asylum seekers. This summer, we will be out in the community talking to more families, providers, and stakeholders about their experiences with early childhood education and care. And we want to talk with you. We invite community members, families, and early childhood professionals to join the conversation by filling out a council interest form. Please go to www.birth-to-5il.com/council or click the link in the description to get involved. Interest forms will close later this summer, with council meetings fully resuming in August. I want to thank our state partners for their support and for you watching. We encourage you to stay in touch with us by visiting our regional page at www.birth-to-5il.com/region1bb, joining our Facebook group, or reaching out via email to tdrain@birth-to-5il.com. Links to our pages along with the email address available in the description below. Thank you for your time. We look forward to connecting with you soon.